Good evening. We're going to get started to be respectful of everyone's time, but welcome. Thank you for coming. I'm Diane Zalapi, and I am a member of Farmington SAFE, Suicide Awareness for Everyone, and we are in our 6th year of community conversations. So it's good to see some new faces and some familiar faces as well. I trust that everyone has a program. And our typical format for our community conversations is that we start with an overview from our public safety that grounds us in terms of where we are and why we're here. Tonight we also have a youth perspective, and then our main speaker, Steve Wyndham. So we'll spend a few minutes doing that overview. We have our presentation, and then we have an opportunity for some question and answer. And then if you haven't had a chance, we do have several tables with information from local organizations. So we have Farmington SAFE, we have Maple Grove and Kevin Song and the Suicide Loss Foundation, Common Ground. So there's a lot of resource information. So if you haven't had a chance to ask questions, gather information, there will be an opportunity to do that afterwards as well. And so, without further ado, I would like to introduce to you our Farmington Public Safety Director, Frank Demmer. If you would be, oh, so we mixed it up, we switched it up. Sorry, Chuck.
Well, it's not normal that I take the lead over Chuck Nebus in his own home, in his own yard here, but I'll take it tonight. Thank you very much for the introduction. This is the mayor. Thank you, Mayor Massey. Very much appreciated. I just wanted to touch base with you tonight just to kind of give you a brief overview of sort of the picture we're seeing in Farmington as it relates to mental health and the reality of suicide. Fortunately in our city last year, just looking over the numbers in 2017, they were quite low, which is encouraging, but one is too many. And, I can think of two in 2017, one of which was an attempted suicide, and the other one was actually a completed suicide. The first one was an 18-year-old young man who this originally reported as a man with a gun in one of our parks. And our officers responded and set up a perimeter, and fortunately, with the help of Farmington Hills, we were able to make contact with this individual and ultimately talk the gun out of his hands and take him into protective custody. And we were grateful that we were able to do that, but in searching for the nexus as to what caused this, all the precursors were there. A recent divorce, grades slipping in school after previously doing very well in class, and you could just see him falling down the slippery slope. Whether counselors reached out to him or teachers or anyone else is unknown, but I can tell you this, that we found a very broken young man that day, and obviously did the best we could to facilitate help for him, and in speaking with his mother, things have gone quite a bit better, but it was a pretty edgy time, pretty difficult situation, and we're fortunate we were able to intervene when we did, and hopefully lead to a life saved. The second individual, the one that sticks out of my mind, was where we weren't there in time to talk the gun out of a person's hand, and the suicide was ultimately the result. And this was a woman who had been struggling with some mental health issues. That was the nexus there. 3 beautiful children, older children, an unsuspecting husband, other than the fact that he knew that she was having a little bit of mental health problems. Didn't know to the degree until he came home to find what he saw. And the emotional impact that obviously that had on the family, but everybody who surrounded them was very impactful to me. Speaking of nexuses, I think I'd be remiss if I didn't mention some of the drug use and the overdose problems we're seeing. Again, our numbers are low in terms of overdoses in Farmington, but going off the theme that one is too many, our officers are all equipped with naloxone. We administer that when we do encounter somebody who's had an opioid overdose. And again, when they come to, and they really do come to after they take this drug, you can always pretty much find a mental health nexus attached to the reason why they were taking opioids. So as Mayor Massey said it very well last week during a meeting, you know, we're all too happy to speak in groups, and I apologize if I'm stealing your thunder here. We're all too happy, we're in groups, to talk about anything going on below the neck, you know, our Tylenol, our cholesterol, our blood pressure, all that. But once you creep up above the ears, boy, that really seems to be a conversation that we're not too comfortable to have in public. So, you know, with my officers and in our department constantly having ongoing training with mental health, we have a lot in our community that our community has to offer to help people as well, SAFE being one of those huge components of that. So I just appreciate the opportunity to speak with you today, and thank you very much for being here. Thank you.
And now we have Chief Chuck Nevis of Farmington Hills.
Thank you, Diane. It's my pleasure to be here tonight to talk with you a little bit about a very important topic, talking and saving lives. On a positive note to start, Farmington Hills, sometimes I refer to it as the land of Oz. We win a lot of awards in the last year or so. We have about 5 of them, publications and magazines for being the best, one of the safest cities, one of the best places to live, best places to raise a child. I even saw a study, one of the most intelligent communities. And another one just in the past week is the 5th safest city in the country to retire. So some interesting accolades. But how do we measure up in mental health issues? Nationally, a couple of years ago, I sat on a committee for the International Association of Chiefs of Police, and chiefs from all over the country met, and we talked about our biggest problems, and people thought it would be crime or terrorism or drug addiction or gangs or something, and in uniform across the board, across the country, the answer from the chiefs was mental health. In the state of Michigan, how do we stack up? Michigan is one of the 5th worst states for the number of hospital beds that we have in the country. We have closed mental health facilities for decades and built prisons, and now we're closing some of the prisons because our prison population is down about 10,000, 11,000 prisoners, which is maybe a good thing. Locally, Farmington Hills is a very caring community. I don't have a survey or a study or a national magazine to tell us how we're doing, but I wanted to share about 8 quick things that we're doing in our community that are kind of sources of pride and to show we care, and also it kind of paints a local flavor of some of the activity going on in Farmington Hills. First, we have our SAFE, Suicide Awareness for Everyone, which brings you here tonight. We have many supporting partners and Common Ground and all the partners that are here with tables tonight. Another way that we care is through jail diversion. We have a program where whenever possible, if we have minor offenses, we try to defer people through jail diversion to programs or mental health facilities instead of jail. Another thing we try to do as a caring community and police agency is we petition a lot of people. Over the last 3 years, Farmington Hills officers have petitioned 740 adults to mental health facilities, 101 teens. That's 841 places we found for people to go that were in need of mental health treatment. Another thing that we do to show we care is we have mental health first aid training. It's well known in our community. We've helped sponsor some events. I'm proud to say that every police officer in Farmington Hills has just completed going through 1 day of mental health first aid. Many of the officers have been through the crisis intervention training that you hear so much about that's so popular. But we have many officers, but it's hard to get everyone in the department for a whole week's worth of training. We also use something else that shows we care. We have Police One, Source One training. Our officers do interactive, computer-based training in some of the topics that they have that they're tested on and go on their training records is how we deal with mentally ill persons. Another thing you heard Director Demers mention Narcan. In Farmington Hills last year, we administered Narcan 94 times to 79 people. And you may say, this is probably a pretty educated group, some may say, well, what does that have to do with mental health? Most of those folks are having mental health situations. Another thing that you can do that shows you care is call us in Farmington Hills Police Department or Farmington. If you call, you get help, you can remain anonymous, and we also do welfare checks. So many times we get calls from people saying we haven't heard from somebody or somebody's depressed, and we go and we're able to intervene. And one of the last ways, maybe just to kind of show we care, the community connection, the kinds of programs we do throughout the year that SAFE puts on, including the program tonight. And we do a lot of teaching, and the talking we're going to hear about tonight is important. It saves lives. There's many lives to save. In the last 3 years, the number of adults who've taken their life in Farmington Hills in the past 3 years is 34. The number of adults who've made attempts to take their life is 79. The number of adults who've threatened their lives in the last 3 years is 190. Over on the teenage side, in the past 3 years, we've had two teens who took their life, 29 attempts and 43 who threatened. And I'd like to just share with you before I close is some of the things that I've heard, and police officers everywhere, when we go to one of these terrible scenes where someone's taken their life, the kinds of things we hear. They probably won't surprise you. I should have called. I should have known. I should have done something. I knew something was wrong. I saw the signs, but I didn't think. I didn't want to hurt anyone's feelings. It wasn't comfortable to talk about. I didn't know what to say. Tonight we're going to learn about that talking can save lives, that simple, real conversations can be the difference between life and death. Thank you for allowing me to spend a few minutes with you this evening. Thank you all for coming.
And now I'd like to introduce Josie Edwards, who is a North Farmington High School student, who will also share some thoughts.
Good evening. My name is Josephine Edwards. I am a junior at North Farmington High School and a teen advocate for suicide awareness. Mental health awareness is so important because suicide is increasing at an alarming rate. Because of this, our teens need parents, teachers, coaches, and anyone else that deals directly with young adults to become educated so that they can be knowledgeable of the signs and symptoms of a possible mental health crisis. Teens now struggle with being able to reach out for help when they need it. They need someone to talk to that they trust and will not be judgmental. Some teens feel like no one will understand, and we need to change that. We can only do that by increasing communication and reassurance that they can confide in someone about absolutely everything and anything. Parents, coaches, teachers, friends, and loved ones, be open to talking to teens about mental health. Let them know it's okay to not be okay, and help is possible. We need to break the stigma around mental health and suicide. Someone's life will depend on it. Thank you.
Thank you for all of that important information. So I'd like to introduce Steve Wyndham, who's the Executive Director for the American Foundation of Suicide Prevention in Michigan, and he will be our speaker this evening. Thank you.
Thank you, guys. So I am the area director, not executive director. I haven't got that pay grade yet. So, but I do cover the state of Michigan. So thank you guys for being here tonight. Thank you for the updates from the police officers. We're actually doing a training next week and the following week with Farmington Police through Ted Worthman. We'll be working with the officers to actually do this presentation, Talk Saves Lives, with our local officers here in Farmington. So lots of great things happening. Thank you so much to the organizations that are here. We work very closely with Kevin Song and the Lost Foundation and Common Ground and Amelia and Bob and everybody. It's such a tight-knit community with the suicide prevention area. A lot of people who have been affected reach out to each other, and it's really about that support and the ability to connect with one another, know that we're not alone in this fight. And so tonight is a topic about prevention. So if you have suffered a loss, I'm so sorry for your loss. AFSP has so many things for your loss and for your healing, not only with Common Ground and the Lost Foundation, but we do things with loss survivors and healing and grief counseling and survivor outreach. And so tonight is on a different topic, but if you'd like to learn a little more about what we do with the post-vention stuff, please see me after. But today is about Talk Saves Lives. And so this is our introduction to suicide prevention. It's got a lot of great things in it. We're going to run through a few things, but the biggest issue is that suicide is a health issue. It's not a criminal issue. It's not a moral issue. It's not a character issue. It is a medical health issue. It is complex, and there is a lot of things that we're still learning about this disease and this issue with mental illness and suicide, but it is 110% preventable. And for those of us that have lost, that is tough to hear sometimes, but the fact is that our story, our song, our message can help save lives in the future. And so what we do know is that this is a preventable issue. And the work that we're doing with our community partners and the police departments in these cities will really actually stem this cause. So today we're going to go over a few things. We're going to go over the stats and what's happening with this issue. We're going to go over the research that we're doing around the issue of mental illness and suicide prevention. We're going to talk about the things that do work in the prevention realm. What do we know works? What do we know is out there that's been developed? And then we're going to finish with what can you do? And the thing on the seats today, our Talk Stays Lives brochure, this really is the information in that last section. So this is the takeaway for all of you guys. There's extra ones in the hallway if you'd like to have these on hand, like to take a couple extra home. If you're with an organization, a school, an office, anywhere that could utilize this information, AFSP spends our local dollars on disseminating information and materials. So if you'd like to talk about getting some information in your hands about after a suicide or supporting a loved one who's made an attempt on their life, we have lots of great things that our local dollars go to. So any questions before we dive into the program? All right, let's go. So stats. So some of this is really eye-opening. Some of this will take you by surprise, but every year, over 800,000 people die every year by suicide. And this number is very modest, and this is from the World Health Organization. And the reason this is a very modest number is because not all countries report suicides accurately. They report them as other types of death, as accidents, but they don't actually list them as a suicide in their death reporting. So what that equals out to is worldwide, someone is dying by the issue of suicide every 40 seconds. And so in the 40-minute presentation we're going to give tonight, that's going to be at least 40 people who have died worldwide. What we know in the U.S. is that suicide is the 10th leading cause of death in 2016. So this slide is a little outdated. The CDC just released the 2016 numbers. This number did go up again, sadly, and so it was about a 3% increase in the number of suicides. So this slide will soon read 44,963, I believe the number is. And so we're just shy of 45,000 people who died in the U.S. And of the top 10 leading causes of death, so heart disease, lung cancer, obesity, whatever these top 10 leading causes of death, suicide is the only one on the rise. Every other top 10 leading cause of death is seeing a decline in their mortality rates, but suicide is seeing a rise. We also know that for every death, there is at least 25 attempts. Now, again, this is a modest number due to the fact that these are recorded attempts, whether the police were involved, hospitalization was needed, doctor's attention, but this is something that we know, again, to be a very modest number. But what the scary thing is that that equals over 1 million Americans every year attempting their life. We also know that a majority of people will be affected by a suicide in their lifetime. I used to work at the American Cancer Society, and we used to tell people that 66% chance you will be affected by cancer in your lifetime. Whether you get it, someone you know will get it, you will be affected by this issue. It is a 63% chance that you will be affected by the issue of suicide in your lifetime. Until we get this under control, suicide does affect at least 100 people when the death does hit. So it does rock a community, it does rock a school, it does make things very troublesome for those who have experienced the loss. And as I said earlier, there's a lot of things for suicide loss survivors through AFSP, the Loss Foundation, through Common Ground, through Kevin's Song. There's a lot of great organizations here locally that if you have experienced that loss, we can help you connect. Looking at an economic value, and so when we go to the state capitol every year for our state capitol day, when we go to Washington, D.C., and we talk with our legislators and our elected officials, one of the things that we hit home with them is this dollar amount. And so every year, the issue of suicide cost us over $51 billion in lost wages and productivity from those lives that are taken, and the ripple effect that happens when a life is taken by suicide. So those 100 people that are affected, their wages, their productivity, those things are affecting our economy. And so again, this is a preventable issue. So we could at least one day save the country $51 billion. So any questions about the numbers? That's a slide. Another cool number coming up. So research. So what we do know is that there is no single reason for when someone takes their life. This is the one thing that we have to dispel. The biggest myth about is that there was an action or an event that caused someone to take their life. It is when many, many things come to an intersecting path. Yes, there can be one precipitating event that takes someone down that very dark road, but it is a multitude of things that intersect in their life to lead them to a suicide. We also know that when there is a suicide, 9 out of 10 people, over 90% of them, have a mental health condition at the time of their death. That is a mental health condition that is either untreated, mistreated, undiagnosed, or misdiagnosed, or they might be self-medicating. But the fact is that over 90% of the people who are dying have a mental health issue. So again, going back to the things that the city is doing, going back to the things that our communities are doing to instill smart mental health behavior and smart mental health tools will help save these lives as well. We also know that 1 in 4 Americans deal with a mental health issue. So we know that 1/4 of our population is suffering from some sort of mental health condition. Now we have to remember that mental health is just like cancer or diabetes or any other major medical illness. There's a spectrum. You could have very mild depression, which you're suffering from, and exercise and yoga and better diet and a couple, talk therapy sessions a year can help you. You could have major depression where medication and weekly therapy is what's necessary for you. You could have bipolar 1, you could have bipolar 2. There's many things that affect this, but the fact of the matter is that not 1/4 of our population is dying by suicide. So just because you have a mental health issue does not make you deemed to die by suicide. You can live on with this and you can be a productive person. Some other things that we've discovered by our research and through actual physical autopsy is that when someone does die by suicide, their physical brain structure is different than someone who dies by medical causes, other medical issues. And so the way that their synapses are wired, the way that their brain is actually communicating with itself, with decision-making, long-term judgment, impulsivity, these areas of the brain are affected so dramatically in physical structure that if you think about if your liver or your heart or your lung were to physically alter itself, it would not work either. But our brain is doing this through the chemical imbalances, through the rewiring, through the trauma that we experience. But we know that this is not something that is just a choice. It is something that your brain does. Your organ is malfunctioning in this issue. We also know that people who want to kill themselves are ambivalent about death. There's a part of them that wants to live, and there's a part of them that wants to die. The key strategy in suicide prevention involves engaging the part of the person that wants to live and help distance them from the part that wants to die. And the way that we do this is connecting with them about reasons to live, decreasing the visibility and other triggers around them for those suicidal ideations, and also helping foster an area of connection and family and support. What we've also learned is that a crisis point has been reached. So when people say, I don't know how they could do this, I don't know what they were thinking, you never will know what they were thinking, because until you have had your brain physically rewire itself and you've reached this crisis point, you'll never be able to walk through someone's shoes who has this thought. So I want you to think about the most painful time in your life, whether it's passing a kidney stone, or it's having birth, or it's having organ fail, or a broken bone, or a major limb. And I want you to think about that most painful moment. If I were to sit down with you and walk up to you while you're laying on the ground with a broken leg and your bone is sticking through your skin, and I said, hey Bill, how do you get to your house from here? Can you give me turn-by-turn directions to your house real fast? You're not going to be able to do it, most likely. You're going to tell me to go away and call the ambulance. And so the fact is that in this point of crisis for a suicidal person, that's the pain they are experiencing. They are in a point of crisis, whether that pain is physical, emotional, or mental. This pain is real, and it is manifested through our brain in the exact same way that a physical injury is. And so when this person has reached this part of their journey and their ideation, it is important, whoopsie daisy. It is important to maintain that connection to the part of them that wants to live and help them through that crisis. Because what we do know, and we'll talk a little bit about this in prevention, is that a crisis will alleviate. We just need time. So the goals of our research, and AFSP is actually the largest funder of suicide prevention research, second only to the federal government. One of the other things that we lobby for a lot at the federal level is more funding to NIH, to the Mental Health Association, to get more funding to the issue of suicide prevention. AIDS and HIV and things like cancer, they receive billions and billions of dollars in funding, and suicide prevention gets $37 million a year from the federal government for prevention funding for research. We will soon surpass that number at AFSP if the federal government doesn't get their act together. So the next time you're going to vote, the next time your voice has been heard, I would urge all of you to sign up for our Field Advocate program. You can go to afsp.org and you will get an email when your voice is necessary to talk about a bill or a law or to sway your elected official one way or the other on an issue that deals with suicide prevention and mental health research. And so you won't get spammed, you won't get a lot of questions, and that you actually get an email when your voice is needed to help pass laws in the area of funding and access to care for mental health. Well, the things that we are working on are biomarkers, how to detect mental health earlier, how to detect depression and anxiety earlier. Interventions and psychotherapies are a big piece of it, what works, what is actually curing our patients, and then medication. The sad thing is that there is no silver bullet with mental health, and so what one antidepressant might work for one person will not work for another, and it will have drastically different side effects. And so medication is a key piece of it. Just like you would take medication for cholesterol or diabetes or anything like that, we have a huge stigma in our country around medication for mental health. But if you did not take your cholesterol medicine, your heart probably would stop working. If you don't take your mental health medication, your brain is not going to work either. So it's the exact same thing. We just have to get there and see it as our brain is an organ. It is not who we are. Our brain and our mind are two different things. And who we are and what our organ is doing is one thing we have to connect with people on to see. So the other thing that we're looking at, this is really close to me, I apologize, is who is at risk. And so the things that we want to focus on is just, are these three areas. And this is actually in your program as well about the areas of risk. And they break down these three things. And the person who is most at risk is that very, very centerpiece right down here. This is the person that we're worried about the most. And so these different areas, fall in through those areas. So health factors is mental health conditions, depression, anxiety, bipolar, eating disorders. A lot of people do not understand that an eating disorder is a mental health condition. It's not some medical issue. It is a mental health issue as well. Substance abuse as well. So these type of things, if someone is experiencing this, or if you think they might be into this, or they're going down that path, this will be something that will help raise the risk of their suicide. The other thing that we know is that 91% of mental health patients have at least one chronic physical illness alongside of it. 64% of our mental health patients have two chronic illnesses as well. That could be pain, it could be joints, that could be liver disease, it could be cancer. And so mental health and physical health are so intertwined, but yet we treat them so differently. And as it was said earlier, that people want to talk about the ears and lower, but they're so connected, and we have to get people to start treating them together. The other thing as well is that serious head injuries. And so we see a lot of talk in the NFL about these players who are having this DVT, these issues, and then they're dying by suicide. And so major head injuries, closed head injuries, do put people at a higher risk. So it's just intelligent to have evaluations and checkups and making sure that we're monitoring those situations. I myself had an epidural hematoma and a fractured skull in college. And so I spent 4 days in the ICU with my head shaved, getting prepped for surgery because of the bleeding in my brain. And so I have to go back every 5 years to get my brain checked out. I do regular therapy just because of the job that we do and the stories that we deal with, and just to be able to kind of carry that load. But it's about the intelligent, health-seeking behaviors that we continue to preach. Historical factors are a big piece of this as well. So if there's a history of suicide in a family or a history of mental health conditions, this is a big piece. Talking about family history. This is one of the things that took cancer and heart disease and diabetes decades to get their family members to talk about. An older generation didn't talk about their health. It was my issue to deal with. My family doesn't need to worry about it. I don't want to be a burden on them, so I'm going to deal with my health, and I'm going to continue to take care of my family. This is the same thing. For many years, I did breast cancer, and one of the biggest things we talk to women about is having a conversation about your family history. Is there breast cancer in your family? Did you not know about it? Did you know? What's the thing? Mental health is the exact same way. We have to have a conversation about what happened in our family. Did someone have depression? Were they an alcoholic? Did they have a substance abuse disorder? What are these signs that we wrote off for years and years that, oh, Aunt Ginny was just crazy, but actually she was suffering from something very serious? And so we have to have that conversation. Childhood abuse and neglect is a big issue as well. We know that there's a program called the ACEs score. It measures the trauma that a child goes through. These ACEs scores are directly related to the amount of mental health conditions and mental illnesses that children have based on the trauma they experienced in their life. And then also previous suicide attempts. So obviously if someone has made an attempt, they are at a higher risk for suicide, but we also know that over 80% of people who do make an attempt go on to get treatment. They become productive citizens again, and they don't have an issue furthermore if they maintain their treatment. Environmental factors are a big issue. I'm going to skip the first bullet because that's a major factor, but prolonged stress, stressful life events, and access to lethal means are one of the major things in our environment. Safe storage of guns is a huge issue that we're fighting right now. We're doing a huge education piece around firearms and suicide prevention, trying to talk to the firearms owning community and educate them on the signs and symptoms of suicide risk so that when these creep up in their homes, removing the firearm, securing the firearm, removing access to lethal means. Now, lethal means can be a car, it can be a high building or a parking structure, it can be a bridge. It's not just a firearm, so it's removing the access to that. But also having stress in these life events, we know that most mental illnesses set in during times of transition, these stressful times after a divorce, high school to college, parenthood when it first comes along for a lot of us. And so these stressful things are very important when we teach coping mechanisms and stress healers for our young people. But exposure and contagion is the one I want to stick on really fast because this is a major fear in schools we talk a lot about when we come in and we say, well, if I talk about suicide, I'm going to cause these kids to kill themselves. And in reality, we know from our research that talking about this issue will save more lives than ever. You're going to help those that are suffering, and you're going to help educate those who can reach out and connect with those that are suffering as well. The reason exposure and contagion is dangerous is when these issues of suicide, these stories of suicide are reported wrongly in a grotesque or romanticized manner, that others who are struggling have now been shown this way, this death, as an act of revenge, as a tool to be remembered by, as a way to get back at someone, as a romantic story to the ending of my love song. It is a very, very big issue when we talk about the death at Motor City with Chris Cornell, and he died, and we describe what happened and how he did it. We work very hard with the media to report on the issue of suicide as a health issue and not a criminal issue, which is usually reported on, because we know that when we tell stories in the wrong way and we romanticize all of these issues and we get people to realize that this is a tool for you to use, it will increase the number of deaths and it will increase the numbers of attempts. There is a study out of Seattle when Kurt Cobain died in the 80s. 80s or 90s? Is it 90s? 90s. And so when Kurt Cobain died, the media got together in Seattle and they reported on this in a way that had never been seen before. There was statistical research that showed there was a drop in the number of suicides and a massive increase in the numbers of appointments, outreach, therapy, counseling. And so the media plays a huge part in what we do with saving lives. So this is a really quick fact about how the media, how they're reporting, and how all of this plays together. And so what we see, this is when a suicide occurs. And so what we see is this heartbreak. We'll use this heartbreak as an example of a man got a divorce. So Steve got a divorce, and I lost my 3 kids. I do have 3 kids, by the way. This rest of the story is fake. Had a divorce, and I died by suicide. That's what everybody sees. Oh, God, poor Steve. He got a divorce, and he killed himself. That sucks. Man, that's not it. That's not the story. What we don't know is that my uncle died by suicide, my mother had depression, and my father is bipolar. My genetic risk is through the roof with this issue. I have depression of my own that I've managed it since I was 13 years old. I never had to seek counseling for it, but I started to drink when I was in college, and it seemed to cure it. Started to smoke a little pot in college, and it seemed to cure it a little more. So these are the things going on. I got a brand new job at some nonprofit as a state director, and that really got a heavy load, and my work got really stressful, and so my depression got worse, so I started drinking more, and then I neglected my kids. My wife left me, and then boom, I died. But it's not just the breakup. It's everything. It's my bipolar father, it's my depression of myself, it's not seeking counseling. There is so much more to the story of a death in this community, in any community, that we can't just focus on that single life event. Because as we know from our research, there is no single reason for why someone dies by suicide. Questions? So prevention. This is a fun part. So what works? These things are the most empowering pieces of preventing a suicide. Mental health care, number one thing. Family and community support. Farmington Hills is one of the best communities I've seen in this issue. The safe community organization, the conversation, the outreach, the things that we're doing here in this community and we're starting to do in the greater part of the state, we are making these communities stronger. Our Out of the Darkness walks empower this community so much. We use those walks as a way to connect with people, with support, with networking, with healing. to make sure that you know you have somewhere to go in your darkest hour, because we get what you've gone through. Whether it's lived experience and those who have made an attempt on their life coming to find the respect and the gratitude and the support that they need, or it's a lost survivor who just lost their son 3 weeks ago and wants to talk to another mom who lost her son as well. It's this area of community support that we're trying to establish, and tonight is one of those major things. Problem-solving skills starts from a very, very young age. I know that I'm still learning problem-solving skills every single day. On a true story, I do have 3 small kids, 7, 4, and 1. And I know that in college I had a couple holes in my walls because I got so angry sometimes I would punch a hole. I can't do that in front of 3 kids anymore. So I have to find new problem-solving skills every single day. I have to work out, I have to go for a run, I have to go do something else to alleviate my problem and have to deal with my stress. People need to understand that no matter how old you are, you continually have to learn problem-solving skills for your life. And culture and religious beliefs. When we start to talk about this issue more, when we start to have ideas that suicide is not the answer and it's actually established that you do not have to feel this way, you do not have to end this way, when our culture and our religious beliefs come together around this issue, they'll be much more stronger. But the biggest factor is time. Time away from that side of the person that wants to die, more time with that family, with that support, more time away from those lethal means, and just more time to connect. The biggest thing that we need is time with each other and time to just have a conversation. And mental health care. So again, we're going to drive this piece of it home because one of our major messages at AFSP is help-seeking behaviors. I know that I'm not a mental health professional. I am not trained in any clinical matter. I've been through assist training, I've been through mental health first aid, but basically I have a CPR degree in an area where it takes a doctorate to be able to save a life. We don't do counseling or service at AFSP. My job is to get you to the people who can actually save a life and who can actually help you. What we do, and we talk about a lot, is that if someone in this room right now had a heart attack and they just screamed and they fell out of their chair and they clutched their chest, I was like, oh, hey, exercise and a healthy diet is really going to help. All right, good job. Good advice is not going to help that person. The good advice you want to give someone that's dealing with a mental health condition is only good enough to get them to the help that they need. You need to get that heart attack victim to someone who can save their life. You need to get that person who is struggling with a mental health issue to someone who can save their life. The problem is that only 2 out of 5 of us seek help. That's a major issue. Whether that's insurance issues, whether that's access, whether that is the fact that you haven't given yourself permission yet to receive that help, we need to have better conversations to understand that treatment does work. The sad reality, though, is that there is not enough treatment options available. We know that in the Upper Peninsula of our state, there is not a single licensed child psychologist in the entire part of the state. If you want to see a specialty child psychologist in the UP, you have to drive to Wisconsin or you have to drive to the Lower Peninsula. That's a huge issue with us. So that's the thing that we're talking about. We're talking about more access. We're talking about better treatment. So when you do get treatment, again, it's not my good advice. It's not talking to a friend. It is real mental health treatment. See a doctor or mental health professional. Get a real evaluation and discuss the treatment options that work best for you. There is no silver bullet. As I said, nobody's treatment plan is the exact same. Just like for every single different type of cancer, there's a different treatment plan. Every single mental health patient has a different treatment plan as well. Some other things that we're working on too are laws for access to care. In the Bush administration, in 2008, we passed a law called the Federal Mental Health Reciprocity Bill. What this meant is that if you work for an employer of 50 employees or more, and you have a health coverage plan, whether it's Blue Cross or it's Aetna or HAP or whatever it is, if your employer is 50 people or more, your mental health copay is the exact same copay as your physical health copay. So when you walk into your primary care physician, and you, hey doc, I need my physical, cough and turn, here's my blood, whatever, 25 bucks out the door, thanks so much, see you next year. Every month when I go to get my therapy, hey doc, what's up, how's life, my kids are crazy, my dog pooped on the lawn, like all this stuff I'm talking to my doc, 25 bucks, all right doc, see you next week, next month. Problem is that there's insurance loopholes. Does that provider take your insurance? Are you on Medicaid? Is your EAP going to be that they refer you to? So a lot of loopholes in the insurance game, but there is a federal law that says your mental health care is on reciprocity or on par with your physical health care. We need more action around it. We need to close those loopholes. So again, I would urge you, sign up to be a field advocate and give your voice to help others get their treatment and get their access. Some other things about mental health care, just like any other issue we said about chronic illnesses and diabetes and cancer, we're going to keep likening them back to these other major health issues because people are educated about these things. People understand that healthy diet and sleep will help me get over my cancer faster. Healthy diet and sleep will help me manage my cholesterol better. Healthy diet and sleep and stress management and exercise will do the exact same thing for your brain. And sleep is one of the most critical things for anyone dealing with a mental health issue. Regular sleep schedules are imperative for a mental health patient. Regular wake, regular sleep, it helps regulate the chemicals and function of your brain. The other areas as well, exercise, take care of your body, healthy diet, what you put in is what you get out, and stress management. Again, ways to cope with stress so your body isn't having weird things happen like a tumor or night terrors or some crazy thing where you're not managing your stress. And access to lethal means. This is a big piece of it as well. We know that limiting access is a big piece, and we know through research that when someone has a plan for suicide, when they've picked out the way that they choose to die by, whether it's a firearm or a bridge or something like that, if you can prevent them from accessing that way, they do not go on to find a secondary way to die. Once they have a plan, they stick to that plan. And if you can easily and simply prevent that plan, you will save that life. Some options that we do that through are CO2 sensors in cars. Older cars are still a risk for some people to die by suicide. Newer cars actually have federal regulation about how much the air has to cycle throughout the car, parts per million and cycles per minute. So it is a less effective way. Barriers on bridges are huge. There's actually a new barrier on the Golden Gate Bridge that's gone up and it's dramatically reduced the number of suicides. That bridge is the #1 destination in the world for a suicide in the US, and so we are trying to have more barriers on bridges. The city of Ann Arbor had a few suicides off their parking garages not too long ago. They spent over $1 million to put up fences on every single parking garage in the city. It looks not that flattering in my mind, but I think to myself that what would you do with $1 million into the mental health system and treating patients and causing and affecting the root cause and not just putting a Band-Aid on the issue. Blister packaging, this is something that I never had the aha about until I came to AFSP. When I'm trying to take my allergy or my cold medicine and I have to peel off the foil and then peel off the fur and then take back the one and then pop it out sideways and it takes me 17 minutes to get one pill out. This is a prevention measure. This is to instead of a loose bottle of pills where I can dump them in my hand and swallow all of them at once, this creates time. This creates time for someone to come through their crisis. If they have to pop out a pill every 6 minutes, it's a little more harder to get there than it is with a bottle. And firearms, again, we cannot preach this enough. This is one of the biggest things. Over half of all suicides are done by firearms. And if we can secure those and keep them out of the hands of those who are struggling with a mental health issue, we will save so many more lives. And so this is not a Second Amendment issue. This is not a gun control issue. This is educating the firearms community about what to look for in their loved ones and when to remove the firearm from that person's access. But the biggest thing too is supporting those lost survivors. We know that when you do experience a suicide in your lifetime, you're twice as likely to have a mental health issue, and your risk of your own suicide goes up dramatically as well. And so supporting lived experience and lost survivors is one of the biggest things that we do, whether that someone made an attempt or that they've lost a loved one. We need to be here for each other and try and just be concerned and help understand. Questions about prevention? So here's the fun part. So this is the meat and potatoes. So this is what we take away. So this is like what we learned, the aha, the why did I sit here and listen to these other slides, because this is what we get to. We get to learn about what can you do and how to every single person in this room help. We have a conversation. We so often don't want to reach out to someone. We talk to each other. We don't talk to the person we're worried about. We need to have that conversation. And what we're doing is we're going to watch for these signs, which we're going to go over in a minute. We're going to reach out, and we're going to help that person seek help. If you're familiar with QPR, you question, you persuade, and you refer to mental health treatment. Same thing here. You watch for signs, you reach out, and you get them the help that they need, that real mental health professional. So what are we looking for in signs? These are 3 areas of talk, behavior, and mood. Whenever I go through this part of the presentation, I ask everybody in the room, who's heard of stop, drop, and roll? My 4-year-old knows stop, drop, and roll. Okay, now another fun, blistering question. Who's ever been on fire? Have you ever had to use stop, drop, and roll? You have. Ken, you are the first person to ever raise their hand in 18 months I've asked that question. Thank you for ruining my presentation. Dr. Ken Massey, everybody, of course. No, but seriously, my 4-year-old knows the words stop, drop, and roll. And I really hope he's never on fire. Talk, behavior, mood. 3 simple things that we need to watch out for to save a life. The talk, wanting to end their lives. I should just die. I should kill myself. I'm a burden on others. I'm trapped. I'm hopeless. Why am I here? I have no reason to live. You would be better off without me. Many, many times, these ideations and these warning signs are verbally communicated, but they also are written as well. So reaching out to teachers and other places that we're doing training as is very important for us to help catch these signs. So when someone wants to end their life, their behavior, increased use of alcohol or drugs, too much sleep, too little sleep, acting recklessly. This is a big one with our youth. And this recklessness is not the 16 I'm invincible, but the literal ideation of I don't care if I live or die because I'm going to drive my car 100 miles an hour for the thrill because I need something to feel alive. That's when we're starting to get worried, that extreme recklessness. Withdrawing from activities, quitting sports teams, quitting church groups, not showing up to our book club, isolating ourselves purposely, looking for ways to kill oneself. This is a big thing with our digital age. Looking through your child or your loved one's search history. If they're watching videos of other suicides, if they're looking for ways to kill themselves, this is a major red flag. And then giving away possessions. And now this can be physical possessions. This can also be monetary expenses as well. When we know someone is about to take their life, they want to leave their mark on the world. They want to be remembered. They want to leave something behind for someone, for their loved ones. One of our board members, his son, worked for almost a whole summer to save up for a car. 2 months before he died, he started to buy his little brothers Xboxes, PS4s, $100 shoes. He didn't realize this. He thought his son was just being generous to his little brothers. Much later, his son was dead. So it doesn't just mean physical things, it's monetary as well. So these behaviors are something to look out for. And then in our mood, depression, again, apathy, anxiety, irritability, having a short fuse, being very impulsive. The humiliation one is up here because this usually occurs after someone has an outburst or they have a withdrawal or they have an episode where they drink a lot and they make an embarrassment of themselves, they lash out. This humiliation usually comes after these highs and lows come through. And the agitation, someone who's very just agitated and not their normal self. So these are, again, a mood that you're looking for. And all of this, the talk, the behavior, and the mood, this is something that is a change from our baseline. This is something that we have not seen in someone that we love. This is something that is totally off the wall. This is like, wow, why are they saying this? And it's not just once. It's for a continued amount of time. It's for a long enough time that we are worried. So the thing that we want to preach to everyone is trust your gut. As I said earlier, a lot of the times we have conversations with one another about being worried about Ken, about being worried about Steve. Man, what was like Tommy's problem at that party last night? He just lashed out at us. And then a little bit later, Tommy's dead. This happened to us when I was in college. So I'm a 2-time loss survivor of 2 really good friends of mine. My next door neighbor in sophomore year of high school and a fraternity brother and a roommate of mine my junior year of college. We lost QB one night after a party, and for weeks leading up to his death, we had talked about he was going off the rails. He used to plan our fraternity meetings. He would plan our charity events. He was this guy that was together. We called him QB because he ran the house. He was the quarterback of the house. And we talked amongst ourselves so much about what was going on in his life. And one day he was dead. Now, we did a fundraiser in college that we raised just over $10,000, and we actually sent it off to AFSP. This was before I had any involvement with the organization. I still have the bracelet that I got back from my now boss in 2008. And the issue that I worry and I struggle with myself, and the thing that I've had to deal with, is that if I would have known this today, if I knew this in college, if I knew this in high school, we could have potentially saved someone's life. We could have reached out. I could have talked to QB. I could have talked to Bobby in high school, because we saw all these things, but we never acted. So please, trust your gut and reach out. Because we seriously know that this simple phrase, talk saves lives, is true. And it's evidence-based, it's proven, it is a training that we can say that these simple words are the things that will actually save someone's life. So how do you do this? So the people that we know that A lot of our research is showing us that this new generation, high school kids and college kids right now, they are so open about their mental health. They talk about what medications they take. They talk about the fact that I have a depression counseling session. Oh, I can't go to that party, or I can't make that event. I have my counseling appointment. They're very open about mental health. But when someone's in crisis, when it's time to act, they do the exact same thing everybody else does. They freeze. And so how do we reach out? We talk to someone in private. And again, this information is in the handout. We want to listen to their story. This is the time for someone else to talk. So if you are the person reaching out, do not open your mouth. Express concern and caring, and the only time you're going to speak is when you ask the question, have you thought about suicide? You have to name the beast. You cannot have this, he who must not be named stuff. Are you not going to hurt yourself? Are you? You're not going to do anything dumb? Are you? No, that does not work. Ask, are you thinking about suicide? That validates them, that lets them know that you understand, that lets them know that you are prepared to help them. When you're not afraid of the answer, you empower that person to not be afraid of it as well. And you have to encourage them to seek mental health treatment. This is, again, your good advice is only as good enough to get them to the help that they need. Some things to avoid. Do not minimize their feelings. Oh, your breakup's not that bad. Oh, your divorce is not that bad. Oh, your bankruptcy. I've been through a bankruptcy. It's not that bad. Shut up. Do not tell them that their life is worth living. If I'm in a suicidal crisis, the fact that you tell me, oh, Steve, you've got 3 kids to live for. You have no idea what I'm going through, so do not tell me what I have to live for. Listen. Don't talk to them about this. This is not the time to have an ideological conversation about why they have to live. This is the time to listen and get them to the help that they need. And do not try and fix it, because you are not the mental health, unless you are a mental health professional. If you are a clinician, please try and fix it. If you are not, do not fix it. And if you think that they are going to make this attempt soon, when you ask about that suicide, when you say, have you thought about suicide, they say, yep, I've got a plan, I'm going to kill myself tomorrow, stay with them. A lot of times, we don't make a safety plan. We just kind of think that talking about it will save it. But stay with that person. Remove access to lethal means. Again, whether it's taking away the car keys or staying with them and not allowing them access to a high elevated position, removing a firearm from a home, remove any access to lethal means, and then escort them to mental health services. Some mental health services and resources that we have actually are the hotline and the text line. If you call the hotline, you get routed to Common Ground here in Oakland County, actually. So that is our local provider for the crisis hotline. So thank you to Amelia and her staff. They staff that for us. So it saves, and they talk to so many people, and they are inundated with calls. And it is something that we are working at a federal level to get more funding for. We actually have a bill right now that's passing that this number, this 7-mile-long number, will be turned into a 3-digit number, just like 911 is. This crisis line will be turned into a 211 or a 771. So we have a law that's actually trying to be passed at a federal level that this number will change. So it's not 1-800-273-TALK. Okay, how many generations even know that the letters and the numbers correspond to anything? You know, like the hashtag was called the pound symbol when I was younger, and so it's like, what's going on? But the crisis text line is really cool as well. So they can text the word TALK to 741-741. We have a couple board members that actually work on this line as well. They volunteer a couple hours a month, and they actually receive these text conversations with young people and people who are in crisis. When Chester Bennington of Lincoln Park died not too long ago by suicide, the text crisis line saw their highest call text volume in their history of existence. So again, back to that contagion issue, back to the issue of how we report on this issue, back to the issue of how we tell this story, it really affects a lot of people. And for immediate emergencies, please call 911. You heard the officers talk about the petitions that they do every year. We need more mental health petitions. We need more reporting. We need more continuity between the databases. We need people to be able to get the services they need. And if it is an emergency, get them to the help that they need. But what we do know is that a smart culture about mental health and prevention can really save lives. Talk saves lives, and is the one thing that if you take anything away tonight, those 3 words are the simplest piece. We can make a big difference. And the work that we're doing here today, the work that these local organizations are doing, the work that Farmington Safe is doing, is proof that people need this topic to be talked about. You know, it wasn't long ago that, you know, you didn't talk about smoking. People thought smoking was good for them. I'm sorry if you're a smoker, but like, come on, like 30 years ago, we thought it was healthy to smoke and it was cool. Like, we had to educate the public on what's good for them. We're in this fight right now with mental health and suicide prevention. We have to get the public to wake up that this is something that we're going to continue to deal with in our ever-changing world. and we have to have a culture that's smart about it and give people access to the care that they need. So I thank you so much for listening. Just know that you can make a difference. If you need help reaching out to someone, that crisis line as well can actually give you advice. So this isn't only for the person who is in a crisis themselves. If you are worried about a friend and you need a little more coaching, if tonight wasn't enough for you, need some support, you can actually call that line as well, and they'll help you have that conversation with your loved one or your friend. And so thank you so much. If you have any questions, let me know, and thank you to SAFE for hosting us tonight.
So, good evening. I do have the opportunity to close this out. And as a couple of last closing thoughts, first of all, I'm sorry I ruined your stop, drop, and roll scenario, but it goes with this story. So I had a neighbor across the street who was, back in the day when fireworks were illegal, had decided to show his son how you can safely shoot rockets out of pop bottles, and he knocked it over, and I was out mowing the lawn, and this rocket came shooting across the lawn, hit me in the chest, and that's when it goes poof. Next thing I know, my shirt's on fire, and I practiced what I learned in elementary school, and it worked. So, sorry I may be the only one, but there you go. The questions about schools, we would love to be in the schools. And when Farmington, and I'll just give you a little bit of history, when Farmington Safe first started, that was our conversation, was how can we engage our school system? And at the time, there was a lot of fear that there was this contagion effect, and we did not want to talk about it. Vice Principal Carruthers is now on Farmington Safe. Josie is our youth member, and I just want to say that we're starting to open up that dialogue, and there's so many things. So they're great questions tonight. With that, one of the reasons we have Farmington Safe, and you'll notice our logo has always contained the Let's Talk About It concept. That has been the genesis. Farmington Safe actually started the first meeting in 2010, and that was because we saw some police reports that came through that indicated that we had 11 kids in 1 week that tried to injure themselves or threatened to injure themselves. And we decided that we needed to do something about it as a community, because we are a community that cares. And that said, a couple of city council members, we met, and we started bringing in subject material experts, decided to open that up, become a community board to deal with this, because it takes a community to deal with tough issues like this. And that was the genesis of Farmington Safe. And I want to acknowledge that this is a group of very dedicated volunteers that we meet monthly to plan these types of events. And there are a number of Farmington Safe folks here in the audience, so they deserve a round of applause. So please stand up and get a round of applause. We have youth members, as evidenced by Josie, who, by the way, awesome job. Thank you so much for giving us a youth perspective. I should also mention, because I kind of put Diane on the spot, that I did the mix-up with the public safety director and the police chief, because last week we had a meeting, and it was Farmington Hills Chief Nebus was first, and second came Public Director Demers, or Public Safety Director Demers. So I thought this week we ought to just flip it around. It worked perfectly. I also would be remiss. One of our key members is Sarah Majoris, and normally Sarah's here. She lost her dad on Sunday, so she's not with us tonight. So thoughts and prayers with her, and I think it's important to acknowledge that. Also, I would like to thank all of our exhibitors, because when we first started Farmington Safe, what was evident was we started talking about maybe we don't have resources. We had them, and we found them. But what we couldn't do is connect people with the resources when they needed them. And that's where Farmington Safe really started in. And we decided that we're going to do that with these types of community conversations. So we try and do this every 3 to 4 months is our routine. So we want to invite back all of our resource people because you're the folks we're trying to get people in touch with. So thank you for being here. I want to say Kevin's song, first time you guys have been with us. We have Maple Grove from Henry Ford because of the opiate issues, and we need to start paying attention to that. Our Emergency Preparedness Commission is a big component of this. Our Suicide Loss Foundation, thank you so much for being here because, you know, obviously we have not been able to stop all suicides, but if we can get there, that would be wonderful. That said, I wanted to go to the next slide, which is going to be there. And we're here to talk about things, and Steve has done a wonderful job because we're talking about something that is a taboo subject. It has a huge, this is a huge problem. The statistics were shared with you. Now it's 45,000, nearly 45,000 a year, but that's a big number, and for people to put that into a relative thing, I use this little analogy, which is at 41,000, that's one every 13 minutes. Think of a jet airplane with 200 people on it, and now crash 4 of those a week. That's the number you're talking about. And if you didn't know why that was happening, would you go get on a plane? Would our federal government not fund the Federal Aviation Association? The FAA would get so much funding to figure out what was going on. NTSB would be funded because we couldn't bear that. But yet we lose that many people in terms of suicides just in this country. This is not a worldwide number, this is our country. And I think that we need to have more discussion. It's all about dealing with this major health challenge that is confronting us. Now, fast forward to the opiate problem that you're hearing about. We just got eclipsed because the last number I heard with the opiates, it was about 64,000 a year. So, and I would tag that in. I mean, if you're going to start taking drugs, there's a big crossover point there. And the amount of reporting and so forth, it's hard. By the way, we did decrease back to about 2,000, but that's been going up, the suicide rate per 100,000. And Steve did share with you CDC numbers. The red boxes are those with, those are numbers for suicide. And if you look at by age, 15 to 24-year-olds, it's the second leading cause of death, according to the CDC, third leading cause in the 25 to 34-year-old range. So it's a big problem. I've talked about who Farmington Safe is composed of, but they all have one big single goal, and that's that we're here to change the dialogue on mental health and do something as a community to try and save lives. We've taken this to a number of other cities that have been very receptive. I'm very proud that we took it to the National League of Cities as a city best practice. So there's a Paris, California safe, just, you know, and there are other cities. There's a Grand Prairie, Texas safe. They've incorporated the same type of resolutions we did. And we do it through these kinds of community conversations. Tonight's more of a general awareness. They're all organized by Farmington Safe. We put this out there in the paper. We have literature. We do these community awareness sessions. We focused in on, and Steve talked about different facets. Well, we touched on LGBT youth. We've touched on internet, mental health, substance abuse and mental health, abusive relationships and mental health, surviving an attempt and what goes on after that, and many others over the years that we've been doing this, because it is a multifaceted issue. With this one, you will find in the back of your, and Steve talked about the warning signs, you get to take those home with you, and if I didn't have something to say, that's the piece that kind of summarizes those warning signs. And there's no stigma in getting people the assistance, helping have those difficult conversations, and ensuring that the mental health of your friends and your family is being looked after. That said, the other piece I wanted to say about that is this type of event, next time, I hope that all of you can come back to our next one and bring friends, because this is a community issue. If we can't talk about it, and we're all motivated to be here, and we need to get out there and we need to have those conversations, and that's what this is all about. So bring people back with you so that we help to spread that message. And then this is what I was mentioning, Todd was talking about. This is coming up, this event, which again, it's like the internet addiction that we did several years ago. This is Screenagers. It is on March the 19th. It's at 7 at the Farmington Civic Theater. You just need to contact the Farmington Youth Assistance to be able to get the tickets for that. It is being co-sponsored by Farmington Youth Assistance and Farmington Safe. So this is another interesting topic coming up. I will tell you that Farmington Safe is all local. It is funded by the Graham E. Smith Memorial Fund and the bank, that's the bank. But we have 2 fundraisers a year for this to support what SAFE is. So there's 2 pieces that go into this, but we do a spaghetti dinner at the Grand Tavern, and they've been hosting us for a number of years now. It's always that second Wednesday of June. And I was complimented at one of these events early on that this is a family that had been there. They didn't know that they were in there on a fundraiser to discuss mental health and suicide prevention, and said afterwards, number one, the community needs kudos because they deal with it, and number 2, how can you actually make an event about suicide and mental health fun? And you managed to do that, so that was a good thing. And then the softball tournament, which is the second Saturday of August, and we've been doing that for a few years now. If you have a softball team, and I don't know, there's public safety softball teams, we try and line those up, but basically come out, and again, while it's a fundraiser, it also brings people together for awareness around a very difficult topic. So with that, thank you for being here. Thanks, help us spread the word, and have a great evening.